Hi, it's October 11th, 2020, COVID health update, Oklahoma City, Oklahoma. Optimal Health Associates, Noel Williams, MD. The news with COVID right now is pretty straightforward. If you look in the United States and you look across the world, the many places are having an increase in cases. A lot of that is still driven by younger people, but the global numbers are really kind of skyrocketing again. So if we look at Oklahoma, we had 1,500 new cases yesterday. We're going to crest over 100,000 probably tomorrow. We're at just about 1,100 deaths. Several high schools are closing for the next 2 weeks because they've had such an uptick in cases, and that probably relates to high schools that have been open. Probably relates to not you get fatigued with the plan, and so if you get fatigued with the safety plan and you allow variation because of whether it's football games or homecoming or something, and what happens is you get a huge pulse of infections, which is what's happened. And that's the cause at these schools. It's not, there's huge parties at people's houses or a friend getting together with another friend. It's when you have masses of kids getting together. Now, the good news is, again, this is always rubs people the wrong way. The kids really are not getting that sick. It's very rare for the kids to get sick. So high school kids getting sick, again, probably is just going to contribute to herd immunity. We just don't want them to get adults sick or their teachers sick. So a couple schools closing right now for the next couple weeks in Oklahoma City. This is the beginning of that. It's going to happen more and more, even with good and careful practices, though, because the cases are going to start going up because it's the fall. The temperature is going to drop. The key temperature for proliferation of COVID is about 42 degrees Fahrenheit. So we'll be hitting that across the country pretty regularly in the next month, and cases will start to go up. People will be more inside. The air doesn't circulate as well, so that will cause cases to go up. And then COVID lasts on surfaces sometimes longer than expected, and that will cause cases to go up. And as the CDC has both gotten correct and incorrect, it does spread through respiratory droplets, which they seem to be perpetually confused about. But be that as it may, I think the summary is the incidence of COVID is going to start going much higher again. So we have to be ready for that. It's universal. It's across the world. So the thing we need to understand is who's really going to get sick from COVID. It's older people over 65 to 70, and people with significant health problems. And so the British have a group of scientists, and I forgot the name of the name of this group or this paper. There's either 9,000 or 12,000 have signed on to a paper saying, hey, we need to do targeted things and not just society-wide things. So that means they don't think the whole economy in Britain or the whole British culture needs to shut down, and there's some reasons why they're starting to talk more about this. They think the people who need to really be careful are the people with severe medical illnesses and who are older. And it's kind of what Crested Butte, Colorado did with their initial recommendations that they had for Gunnison County back in the spring is no, older people were not supposed to go to bars and restaurants, and they weren't supposed to congregate with lots of people. And if you had a lot of health problems, you needed to stay home. And that makes a lot more sense. And if we look at why it makes more sense, there's a British doctor who's kept a diary, and then they published patients, and the study got published this last week looking at 2,000 different patients and families and what they went through with COVID and the lockdown and everything. And there was really a pretty skyrocketing rate of anxiety and depression, disease progression, and again, poor diagnoses of things. And that's just the tip of the iceberg. And as we look at what happens when we lock down society again, now that we have and I'm not criticizing the lockdown from before in any way, shape, or form, because we needed to do something to kind of get a hold and figure out what to do. And that was the whole purpose of why I wanted shelter in place and lockdowns, and why a lot of scientists did, because we didn't know what we were dealing with. We now know what we're dealing with. So let's do targeted approaches. I still am going to say everybody should wear a mask. Let's wash our hands. Let's do all that stuff, and let's take our vitamins. This is a disease of nutritional deficiency. If your immune system, and again, there's a paper on this, the goal is to get your immune system to be like a kid's. And so how do we do that? We do that by getting our alpha interferon up with a zinc and a multivitamin and vitamin D and melatonin. And those are the key steps. And sure, you can add elderberry or quercetin, or how do you say it? Quercetin? I always say it wrong. There's other things you can add if you get sick, but the core things is nutrition and preventing blood clots. So again, omega-3, you need omega-3 to absorb your vitamin D anyway, but you need to be on omega-3. And if you're older and get sick, you need to coordinate with your doctor the plan. I'm just talking generalities here. It's about nutrition. So keep your nutrition up, take your zinc, your vitamin D, your multi, your omega-3. You're going to be in really good shape. If you have little kids, have them take a Flintstone with zinc. It's 10 milligrams of zinc in it. It's perfect, and then the multi covers them. So again, it's really basic. We don't have to keep this complicated. Number two, no, I still think the kids can go to school. The CDC guidelines that were eventually let out, which said you could go to school, were correct. Their original ones, or they weren't going to let anyone go to school, were totally incorrect and wrong and political. Sorry. And that's going to be an ongoing debate for forever. Was it the right thing on the Trump administration side to open schools or not? It was the right thing. Okay, kids need to go to school. Period. Was it the right thing for the Trump administration, as we saw this week, not to mandate masks on public transportation? No, that wasn't the right thing. That was the wrong thing. When you're in the learning phase, that would have been a very good idea as we were learning about the virus, because it's all about being extra careful till you know what to do. So again, that's the summary of what we're dealing with right now in the United States. Now, if you look at the World Health Organization, interestingly enough, they really are coming. I mean, what would be the right way of putting it, Kim? They're kind of coming out, not against so much lockdowns, but travel restrictions and some of these other things, and some element of quarantining just because you're from one place and going to another place, just like the CDC said. So you don't need to, this whole thing of, if you're in Oklahoma or you're in New York and someone says you have to quarantine 14 days when you get to wherever, it's stupid. If you're not infected, you're not infected. It's that simple. There's plenty of people infected everywhere. It doesn't have an impact on people, especially if you're wearing a mask and washing your hands and taking your vitamins. So again, we have to apply common sense. We need the economy to open. We need schools to open. We need normalization, because the economic catastrophe of keeping everything shut is really going to start becoming clearer. Okay, the delay in cancer diagnoses, the delay in taking care of cardiac patients, all that's going to happen. So you just have to be ready for it. And remember, the World Health Organization, who basically I think is a mouthpiece for China, has said, no, we really need to open things up because people are facing economic hardship everywhere, and that's going to have a greater impact than COVID. Because remember, the survival rate for COVID is well over 99.9 or 99.5% across most groups, excluding older people, which we need to be careful of. And so that's where we have to target. And that's really the summary tonight. I think there's going to be a massive number of cases. If you've been listening to me, take your zinc, take your multivitamin, wash your hands. I would wear a mask. I wear a mask all the time. And maybe in the end we'll be shown that's incorrect, but I think the strongest data shows that it's beneficial, and it's not some plot to limit your freedoms. It's a plot to maybe make you not get as sick, or God forbid, spread it to someone else when you're an asymptomatic carrier. But besides that stuff, we just need to try to live a normal life. And I don't think you need to wear your mask, like Governor Newsom said in California, in between bites of food when you're eating with people. That was kind of silly. But I do think we need to wear our masks in public. So that's about it tonight. So I'll update you as the week progresses, and we'll go from there.